So I'm going to go ahead and introduce our next speaker, and that's Brenda over here to my left. She's the director of medical imaging at Overlake Hospital. She's been there the past 7 years, and she's been in the imaging profession for 25 years. In addition to her role at Overlake, Brenda is an adjunct professor at Bellevue College, teaching marketing and finance in the BAS program. Brenda owns and operates her own consulting business for professional development, and has recently published a book entitled Moving from Judgment that released last month. Brenda is actively involved in the AHRA, earning her CRA in 2003. She has participated in many speaking events, poster presentations, and has volunteered at the national meetings for the past several years. Brenda is currently serving as the national chair for the AHRA membership campaign. Please do me a favor and give a big warm welcome to Brenda Reinhardt. I don't know where your clicker went down there.
I know. Clicker's gone. Let's see if this works. Oh, it works. How about that?
Much better than me.
So I'm sure everyone is completely aware of what's been happening in the news, and very recently we had this chain reaction, so to speak. We talk about radiation exposure at the point where it's become a literal celebrity in the news. I mean, you can't turn on anything or look at any articles or anything without them talking about radiation exposure. The FDA investigated more than 600 patients that were exposed to elevated doses of radiation due to CT perfusion imaging. They investigated these because there was something turned off on a particular CT unit that was exposing people to excessive amounts of radiation. In lieu of that and a couple of other things that happened in the state of California, then California jumped up immediately and took the initiative to be the first state to adopt some pretty tough laws specific to recording and tracking and reporting radiation dose to the patient or the referring physician. Of course, then this creates the firestorm for all of the vendors out there who have to scramble for these practical quick fixes that would enable their equipment to perform these tasks. Some of them were further along than others in developing this stuff, but everybody had to rush to try to figure out how are they going to meet these California guidelines. We hear things about radiation, so a couple of quotes that I picked up. Tracking radiation dose delivered to patients for medical purposes is gathering increasing attention from professional societies and regulatory groups. Patient concern about repeated radiation exposure has prompted a National Institutes of Health plan to require all makers of CT and other radiation-producing scanners used at NIH clinics to have software to track a patient's radiation dose and log it into an electronic medical record. And that is where we are going, folks. In February, the FDA announced a new initiative to reduce unnecessary radiation exposure from CT, nuclear medicine, and fluoroscopy exams. And that was really the first time that the focus turned away from CT only. The agency's three-pronged approach will include issuing safeguards requirements for device manufacturers incorporating quality assurance measures. And we're going to see more and more about that as we talk, because then, of course, the wonderful Department of Health, of course, for the state of Washington jumped on board. They did that back in October of 2010 and gave us this handout that was 3 pages and said, please post this in all of your CT areas. Now, how many of you have this posted in your CT area, this exact notice? Great, some of us would pass the Department of Health inspection, right? Because they're going to look for it when they come. Well, we hope not. But anyway, they gave it to us and they said, make sure that you have it posted. And then, if you were fortunate enough to see, in August, just this last month, we got a Sentinel event alert. And this thing is crazy, okay? This is from the Joint Commission. And so we can expect, doing what the Joint Commission does, the next time we have a Joint Commission inspection, they're going to ask us about these very things. Now, the summation of this, basically, is this is as a result of the potential dangers associated with ionizing radiation. The Centers for Medicare and Medicaid Services, of course CMS, will require the accreditation of facilities. Now, we knew that was coming, right? If you're a freestanding facility, you had to be accredited by January 1st, and hopefully you guys got your ACR stuff all lined up. And then if you were like us and afraid of our payers out there that wouldn't pay, we're a hospital and we got our ACR anyway, and I know some of you did that as well. But they go on to say, you know, that they're basically saying hooray for the California law, That requires the documentation of the dose of each CT exam, annual verification of each dose by a medical physicist, and reporting dose errors to patients and physicians. In addition, in May, the ACR, of course, launched its National Radiology Data Registry. Now, that wasn't enough, of course. I thought we might discuss a little bit more about what this says, because if you're like me, you know, you're really, really busy, and you may see this and you may glance at it, and then you may put it down on your desk with a stack of other things that are sitting there as well. So I thought we'd cover this just kind of quickly, because it's really important. This is where they're going, and this is the standards they're going to hold us to. They say right test. Okay, we all know that. In order to reduce the exposure of the patient to ionizing radiation, use other imaging techniques. Of course, they're saying use ultrasound or MRI because they don't produce radiation whenever you can. By a show of hands, how many of you have seen an incredible uptick in your ultrasounds lately? Yeah, I was at the annual meeting, the HR annual meeting last month, and we asked that question to a group of people, and almost everybody raised their hand. And that was in contrast to the advisory board meeting that we went to in California, where just a small group of people raised their hand. I know we're personally seeing a growth in MRI and in ultrasound, and our ultrasound's grown 21% over the last 3 years, year over year. So that speaks very highly to the fact that we're paying attention to this very thing. What else it says? Create and implement processes that enable radiologists to provide guidance and to dialogue with the referring physicians. Now, how hard is that, right? And how are you going to prove that? I think it's interesting. I'm hoping these are just suggestions in part because this is really difficult to prove. They also say right dose. Adhere to ALARA guidelines. Of course, we all write those into our policies and procedures, and the Nuclear Regulatory Commission. And then they go on to define exactly what that is. Under right dose, they say adhere to the Society for Pediatric Radiology's Image Gently guidelines. And hopefully you guys have those in your policy and procedures. They say provide physicians and technologists with reference doses based on anatomy, purpose of the study, and patient size. Establish appropriate dose ranges for high volume and high dose diagnostic imaging studies. Now be honest, who has that in their policy? That exact thing. How many of you have ever even heard of that before? Interesting, isn't it? It's very interesting that we're going to be held to being able to prove that we've given our physicians and our technologists reference doses. Radiologists should assure that the proper dosing protocol is in place for the patient being treated. Institute a process for the review of all dosing protocols either annually or every 2 years to ensure the protocols adhere to the latest evidence. Now, we do that in CT, of course, and you have a CT protocol review, but they're actually setting the strict standard. It needs to be annually or at least every 2 years. Investigate patterns outside the range of appropriate doses, okay? So they're saying track anything that's irregular in your dosing. Record the dosage or exposure as part of the study's summary report findings. If you guys aren't on an EMR that does this, it's really, really difficult, and we're going to talk about that when we talk about our TRACE program and what we discovered along the way. They also talk about effective processes, and these are processes that they're going to expect us to have in place. Create and implement policies and procedures delineating those responsible for approving changes to password-protected diagnostic imaging protocols. That came about as that investigation we were talking about in California. They found out that somebody had gone into the equipment and actually changed some of the parameters of the exam to make it better. And in turn, that's why they had such irregular radiation dose exposures. Develop and implement policies and procedures that delineate physical protective risk reduction measures to be taken by staff delivering radiation to patients. This talks about our shielding of both patients and employees and our radiation protection training for all technologists. Just by a show of hands, how many of you guys have an annual radiation protection training course that's mandated? Good. Is it part of a hospital-wide program? Yes, very good. Expand the radiation safety officer's role to explicitly include patient safety and involve the officer in the organization